Understanding schizophrenia is truly a journey of compassion. Schizophrenia is often misunderstood. It's a serious mental illness that affects how a person thinks, feels, and behaves. Imagine a life where thoughts and emotions are jumbled, making it hard to separate a reality from fantasy. This is the daily struggle for millions living with schizophrenia. It's not about having a split personality, as some might believe. Instead, it's about a disruption in the brain's intricate wiring, leading to a disconnect between thoughts, emotions, and actions. This disconnect can manifest in various ways, making each person's experience with schizophrenia unique. It's a chronic condition, meaning it requires ongoing management and support. Yet with the right treatment and understanding, individuals with schizophrenia can live full and meaningful lives. Their stories are testaments to their resilience and the power of hope in the face of adversity. Schizophrenia is a journey, not a destination. It's about understanding, empathy, and unwavering support for those who navigate its complexities every day. Decoding the symptoms of schizophrenia reveals a range of manifestations, often categorized as positive, negative, or cognitive. Positive symptoms, such as hallucinations and delusions, are additions to a person's reality. Imagine hearing voices that no one else can hear or believing things that aren't true. These experiences can be deeply unsettling and isolating. Negative symptoms, on the other hand, involve a decrease in normal emotional responses and behaviors. A person might withdraw socially, lose interest in activities they once enjoyed, or struggle to find motivation. These symptoms can make it challenging to engage in daily life and maintain relationships. Cognitive symptoms affect a person's thinking and information processing. They might have difficulty concentrating, remembering things, or making decisions. These challenges can impact work, school, and other areas of life that require clear thinking and focus. It's important to remember that not everyone experiences all of these symptoms, and the severity can vary greatly from person to person. Understanding these different manifestations is key to providing appropriate support and care. Unraveling the causes of schizophrenia reveals a complex interplay of genes and environment. The causes of schizophrenia are multifaceted and not fully understood. It's not a result of personal weakness or poor parenting. Instead, it's believed to arise from a complex interplay of genetic predisposition and environmental factors. Imagine a puzzle where both genes and environment contribute pieces, and when enough pieces come together, schizophrenia may develop. Genetics play a significant role. If a close family member has schizophrenia, the risk of developing the disorder increases. However, having a genetic predisposition doesn't guarantee that someone will develop schizophrenia. It simply means they might be more susceptible. Environmental factors such as prenatal exposure to viruses, complications during birth, or childhood trauma can also contribute to the development of schizophrenia. These factors can trigger changes in the brain, especially during crucial developmental periods. It's the combination of genetic vulnerability and environmental stressors that likely tips the scales, leading to the onset of schizophrenia. This understanding helps us move away from blame and towards a more compassionate and informed perspective. Section 4. Navigating treatment. A multifaceted approach to healing. Treating schizophrenia is not a one-size-fits-all approach. It requires a multifaceted strategy tailored to the individual's needs and experiences. Medication plays a crucial role in managing symptoms, particularly psychosis. Antipsychotic medications help regulate brain chemicals, reducing hallucinations, delusions, and other positive symptoms. Therapy is another essential component of treatment. Psychotherapy, such as cognitive behavioral therapy, can help individuals identify and manage their symptoms, develop coping mechanisms, and improve their overall quality of life. Family therapy can also be beneficial, providing education and support to loved ones. Social support is paramount. Having a strong support system can make a world of difference for someone living with schizophrenia. Support groups, community resources, and the understanding of family and friends can provide a sense of belonging and hope. The journey of treatment is ongoing, requiring patience, persistence, and open communication between the individual, their loved ones, and their healthcare providers. Section 5. The power of early intervention, a beacon of hope. Early intervention is crucial in managing schizophrenia and improving long-term outcomes. Just like with any other health condition, the earlier it's addressed, the better the chances of preventing further complications and promoting recovery. Early signs of schizophrenia may be subtle and easily missed. Changes in behavior, withdrawal from social activities, and difficulty concentrating can all be early indicators. If these signs are recognized and addressed promptly, it can make a significant difference in the course of the illness. Early intervention typically involves a combination of medication, therapy, and support services. It aims to reduce the severity of symptoms, prevent relapses, and help individuals regain control over their lives. By intervening early, we can empower individuals to manage their condition effectively and live full and meaningful lives. Section 6. Dispelling myths, challenging misconceptions surrounding schizophrenia. Schizophrenia is often shrouded in myths and misconceptions that perpetuate stigma and discrimination. One common misconception is that people with schizophrenia are dangerous or violent. In reality, they are more likely to be victims of violence than perpetrators. Another myth is that schizophrenia means having a split personality. This is simply not true. Schizophrenia is a psychotic disorder, not a dissociative disorder. It affects a person's thinking, emotions, and behavior, but it does not cause multiple personalities. It's also important to remember that schizophrenia is not a character flaw or a result of bad parenting. It's a complex mental illness with biological and environmental roots. By dispelling these myths, we can create a more informed and compassionate society that supports individuals living with schizophrenia. Section 7, a call to action, fostering understanding and breaking the stigma. Breaking the stigma surrounding schizophrenia requires a collective effort. It starts with education. The more we understand about this complex illness, the less likely we are to believe harmful stereotypes. We can educate ourselves and others by reading reliable sources of information, attending workshops, and engaging in open and honest conversations. Empathy is essential. Imagine what it would be like to experience the world through the lens of schizophrenia, the fear, the confusion, the isolation. By putting ourselves in the shoes of those living with this condition, we can cultivate a deeper understanding and compassion. Advocacy is key. We can use our voices to challenge discrimination, promote policies that support mental health care, and create a more inclusive society for individuals with schizophrenia. Together, we can break down barriers, foster understanding, and create a world where everyone feels valued, supported, and empowered to seek help without shame or judgment.